September is Gynecologic Cancer Awareness Month. It's meant to bring awareness to cancers including cervical, ovarian, and uterine. Joining me now is Dr. Allison Staley. She's with Rocky Mountain Gynecologic Oncology at Swedish Medical Center. Now, Dr. Staley, what exactly are all the cancers and how common are they?
Right. So gynecologic cancer actually encompasses an umbrella of a number of different cancers. The ones that you'll hear about are going to be ovarian cancer, uterine cancer, vulvar cancer, vaginal cancer, and cervical cancers are the ones that we take care of.
Okay, great. And how common are most of those? I know they're all probably a little bit different, but what are maybe the most common cancers we see?
Right. Actually, the most common one is uterine cancer, and we see that increasing in rate yearly here in the United States. In 2019, we had roughly 62,000 cases, and that number is anticipated to increase in 2020 as well. The other is ovarian cancer, which I think many of the viewers have probably heard of. That's actually slightly more rare than a uterine cancer. We usually quote to people in the general population, it's about 1 in 70 women who may experience that diagnosis.
Okay, great. And this month is all about awareness. So what kind of symptoms for those types of cancers do you want women to really be paying attention to?
Right. Each of those cancers is actually going to present with different symptoms. Speaking of uterine cancer, since it is the most common, what women will notice is that they will have postmenopausal bleeding. So if you have an older woman who's gone through menopause, any new bleeding that they experience is abnormal, and they should absolutely be evaluated by their women's healthcare provider as soon as possible to rule cancer out as a possibility. The other is actually for women who have not gone through menopause. If you are having periods that are abnormal, meaning not monthly and not every 5 to 7 days, and experience a lot of heaviness or irregularity, that's also something that needs to be evaluated by your women's health provider to make sure that we have a correct diagnosis and that precancer or cancer is not part of that equation.
Wonderful information. And, what message do you have or do you want to give women about really taking charge of their own health?
Absolutely. I think one of the things that comes to my mind that we have as one of our best tools in gynecologic cancer is preventing it. Prevention is better than even a cure. And what we have for that is cervical cancer with the human papillomavirus vaccine. And it only works if the population uses it. And so I think a great message for the viewers to understand is that the human papillomavirus should be given to boys and girls between the ages 11 and 12 for it to be the most effective and prevent cancer for them for the rest of their lifetime. And so what people in Colorado need to know, as well as the majority of the states in the US, is that the human papillomavirus is not part of the requirements and the normal set that's given to children during their vaccines. And so as parents, you need to ask for it and make sure that your children's healthcare provider is actually giving that to them, and make sure that you know that when they are getting it at the right time.
Do these type of cancers impact younger women, older women, across the board? What's kind of the age range for these?
Certainly. So many of these cancers are going to increase in risk as women get older, most particularly uterine cancers, ovarian cancers, and vulvar cancer. But they can affect women at a broad age range. We are seeing more and more women getting affected with uterine cancer because of the obesity epidemic at younger ages. And so that's something where you can see young women, even as young as in their 30s, being affected by this. Cervical cancer, this also affects young women, especially people who are not vaccinated, getting proper screening, and people who smoke tobacco products. And so they're going to be also young women who are affected by this.
Great, thank you so much. Is there anything else that you want our viewers to be aware of this month or be thinking about?
Yeah, I think women in general need to make sure that they're always asking questions of their providers. Make sure when you're going in for your annual visit that you are asking your doctor, what screening tests do I need to be doing? What are my most recent results? And when am I due for more screenings? And then also making sure that they know your family history. Some of our cancers are actually affected by a genetic predisposition. And it's very important that patients make sure their providers know what their family's medical history is so that they can best be advised for any genetic counseling or testing that could hopefully prevent some of these cancers from affecting them in the future.
Great. Well, thank you so much, Dr. Staley, for joining us to spread this very important message. We'll be right back.